Hello, I'm Anna. I'm a student nurse here at UNE and I'm here to perform a bedside assessment. Before we begin, can you verify your name and your date of birth for me?
Celeste Bodette, 2168.
All right, perfect. And before we begin, do you have any pain today?
I don't.
So if you were to rate your pain on a scale of 0 to 10, what would you rate it?
0.
All right, I'm going to ask you a few questions now. Do you know where we are?
The hospital.
And do you know what day of the week it is?
Wednesday.
All right. Patient is awake, alert, and oriented to people, time, and place, and patient exhibits appropriate behaviors and clear speech. Next, I'm going to perform an eye exam. Could you look straight ahead for me? And could you follow the light in? All right, patient's pupils are equal, round, and reactive to light. Next, I'm going to look at your cardiovascular part of your exam. Do you mind if I take a listen to your heart?
That's fine.
I'm going to begin at the second intercostal space on the right. Then move to the second intercostal space on the left. Then we're going to move down to Erb's point. Then the tricuspid valve. And then the mitral valve. All right, patient presents with a regular rhythm, and S1 and S2 were noted in all 5 spots. Now may I see your fingers? I'm going to check your capillary refill. Patient's capillary refill in fingers was less than 3 seconds. Now I'm going to check your refill in your toes. And patient's capillary refill in toes was also less than 3 seconds. While I'm down here, I'm going to examine patient's skin and check for any signs of edema. And patient exhibits no signs of edema. Next, may I see your wrist? I'm going to check your radial pulses. Patient's radial pulses are 2+ and symmetrical. Now I'm going to check your dorsalis pedal pulses. Patient's dorsalis pedal pulses are also symmetrical and 2+. And lastly, I'm going to check your posterior tibial pulses. Patient's posterior tibial pulses are also 2+ and symmetrical. Next, we're going to move on to the respiratory part of the exam. Before I begin, have you had a cough in the past few days?
No.
So no signs of sputum or anything coming up with your cough?
No.
All right. Do you mind if I take a listen to your lungs?
That's fine.
I'm going to need you to take a deep breath in every time I place my stethoscope on your chest. Breathe in and out. In and out. Again. Again. All right, and do you mind turning around so I can check your lungs from the back? When checking my patient's lungs from the back, I'm going to avoid the scapula and work my way down the middle. Take a deep breath in and out. Again. 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 And last one. All right, and then I'm just going to check from the side. Breathe in and out. All right, you can get back in your position. Patient's breathing is even and non-labored, and lungs are clear both posteriorly and anteriorly. And there was no crackling when auscultating the lungs. Next, we're going to move on to the GI portion of the exam. Do you have frequent bowel movements?
Yes.
When was your last bowel movement?
This morning.
Any pain? Do you experience any pain?
No.
All right. Do you mind if I inspect your abdomen for any non-distension?
That's fine.
All right, looks good. And do you mind if I take a listen?
That's fine.
All right, I'm going to listen in my patient's 4 quadrants of their abdomen. And patient has active bowel sounds in all 4 quadrants. Next, I'm going to palpate the area to look for any tenderness or pain. Patient's abdomen is soft and non-tender, and there is no signs of distension. Next, also, how is your diet been? Have you been tolerating your diet?
Yes.
No recent nausea or vomiting?
No.
All right, perfect. Next, we're going to move on to the GU system. Do you urinate frequently?
Yes.
Any pain with your urination?
No.
And is your urine typically clear or cloudy?
Clear.
All right. Do you mind if I look at your... All right, patient's bladder is non-distended. Now I am going to check out your musculoskeletal system. Can you squeeze my fingers for me? Okay. Can you push my hands back? Like, take your fingers and push my fingers back, please. Thank you. And now resist me trying to push them back. All right, I'm going to check your feet. Can you push your feet towards me? And then resist my pushing. All right. Patient has symmetrical range of motion in her upper and lower extremities, and patient has bilateral equal strength in both upper and lower extremities. Next, throughout this exam, I've been examining her skin. I'm going to check for any incisions or wounds or any swelling. Patient's skin is dry, warm. There are no wounds or incisions present. Now, can I just check the turgor of your skin? No turgor in patient's skin. Alrighty, I think I've completed this exam. Before I go, do you have any questions for me?
I don't.
All right, I'm going to lower the bed. I'm going to put up the railings. Let me get you your call bell. Here's your call bell, and if you need anything, just ring that. I'll be back shortly to check on you.
Thank you.